Hi, my name is Khalid Sharif, and I'm a consultant orthopedic surgeon with an interest in sports surgery. And today's video is as a result of a request by one of the subscribers to the channel. They've asked me to speak about PRP and its medical uses. I must say, there's a disclaimer. This use is always a discussion between the patient or the athlete and their surgeon. Um, However, what I'm going to present to you is the most current evidence, all in one video. So if you do like it, please do subscribe and to the channel and give it a thumbs up. So I'm going to be speaking about the types of PRP, the uses of PRP, the protocols for its use, and the side effects from it. The PRP stands for platelet rich plasma. There are four main types. There is the PPRP, which is the pure form of PRP, where you isolate the platelets and use it for its anti-inflammatory and healing effect. And this is used for gentle tissue healing like tendons, sprains. The second type is called the LPRP, or the leukocyte rich PRP, where there is platelets and more white cells, and here the anti-inflammatory and healing effect is stronger, and this is used in musculoskeletal purposes. The third type is called the PRGF, which is has very few cells in it, mainly growth factors, and this is used in gentle, delicate tissues like in aesthetic work and in delicate tissue, basically. The fourth type is called the PRF, which is rich in fibrin. It's very thick, gel-like, and that eludes its growth factors very slowly, and it's used in dental work. So what are the uses of PRP? Basically, PRP is extraction of the platelets, the growth factors from the blood, and injecting it into the area you want the effect to be stronger. So in aesthetic work, although I'm an orthopedic consultant, but I do aesthetic work and I'm qualified. So I'll speak a bit about this, although I may produce a separate video in details about it. There is evidence to show that it improves cell growth, rejuvenation of the skin, skin elasticity, increases collagen production. So it is used to reduce fine lines, pigmentation, reduce scarring, used post acne scarring. It's very useful. The second use I'm going to speak about is hair growth, and it is well known to have an effect on mild, I would stress mild, androgenic thinning, or mild thinning of the hair, and there is evidence to show that it increases the hair growth. Third is in dental work, and there is a place for its use in post-extraction to improve wound healing, also in bone grafts or post implants to encourage the growth of bone around the implant. The other effect is in orthopedics, and here we're going to stress two main avenues for its use, mainly its anti-inflammatory and healing effect in tendons and ligaments. And I have used it in tennis elbow, in trochanteric bursitis, in Achilles tendinitis. It's also used in the spine for degenerative disc disease, facet pain. I've used it in the shoulder as well. Basically in partial rotator cuff tears, in impingement, there is evidence for its use post rotator cuff repairs. I have to stress, it is not the main line of treatment in all these conditions. Always physiotherapy, pain relief, activity modification, use of orthotics or walking aids, and then when it doesn't work, you use the PRP. The other use in orthopedics is in the joints, and in joints there is evidence to show that it increases cartilage growth, and its use in osteoarthritis is got to be in mild to moderate. It's not for severe arthritis. And again, it's not the main line of treatment. There's a lot of evidence for its use in the knee. Now, the protocols for its use, I always tell my patients, I assess them properly and advise them as to the appropriateness and the usefulness and what to expect and what to not expect out of this treatment. Second is you should avoid non-steroidal anti-inflammatories before and after its use. The third is you basically try to do it as aseptically as possible. I always do it in theater. I know some people don't, but I always use it in theater. You draw 20 to 60 milliliters of blood, you centrifuge it, and you introduce it ideally under ultrasound guidance. And the protocol is to use 1 to 3 injections 2 to 4 weeks apart. And I always monitor the patients for 1 to 3 months afterwards. The side effects from the use of PRP are you can get pain and some inflammation and some redness and swelling. This is inevitable, but it's temporary and it will wear off after 3 to 4 days. I always tell the patients to rest for about 48 hours afterwards. Always, as I said, avoid non-steroidal anti-inflammatories because it affects the effect of the PRP. And also, I always monitor them for 1 to 3 months after its use. Again, I must stress there is controversy in the studies out there about the effectiveness of PRP, but there is also undeniable evidence that it's better than placebo. I hope this is helpful.